Hello everyone, welcome to my video on challenging concepts of the autonomic nervous system, chapter 14 in the Marriott textbook. So, both the somatic and our autonomic nervous system both have motor fibers, so they are the efferent pathway, but they differ in a couple of areas, right? So that'll be the main conversation of this video. So, the effectors, hopefully we recall that the somatic nervous system is the effectors will be skeletal, while of the autonomic nervous system it'll be the smooth muscles, cardiac muscles, and the glands. We'll also talk about how they will differ in efferent pathways and ganglia, target organ responses to the neurotransmitters as well. The autonomic nervous system is also called the involuntary nervous system or general visceral motor nervous system. So in terms of the efferent pathways, the somatic nervous system just has one neuron in the peripheral nervous system, right? In the peripheral nervous system, if you think about the descending pathways, yes, we do have two motor neurons we talked about, the upper motor neuron and then lower motor neuron, but the conversation is going to be in the peripheral nervous system. So one neuron, the cell body starts in the central nervous system. It's either from the brainstem or from the spinal cord. It'll go to the skeletal muscle. These fibers, axons, are myelinated, while in the autonomic nervous system there's going to be two neurons in the peripheral nervous system itself. So it's two neurons in the peripheral nervous system. If you recall from conversations previously, a ganglion is a collection of cell bodies found in the peripheral nervous system. So if we have a ganglion, that means it's a cell bodies, collection of cell bodies in the peripheral nervous system. Also recall that motor neurons are multipolar. So if we have two motor neurons or two neurons that are going from the central nervous system out into the periphery in that order, in tandem, we're going to have one motor neuron, and then the second one's going to be the ganglion. The cell bodies are going to be called the ganglion and the second motor neuron. So the name given is the preganglionic neuron. That's for the first neuron, and then the second neuron in that sequence will be called postganglionic neuron. So again, a difference in the autonomic nervous system is that the preganglionic neurons are lightly myelinated, while the postganglionic neurons are unmyelinated, and these will extend out into the effector organ, right? We will elaborate on this with the separation of the sympathetic and parasympathetic as well. So in terms of the neurotransmitters, somatic nervous system just secretes acetylcholine, and when the motor neuron secretes that on the muscle fiber, it's always going to be stimulatory, so it's going to cause depolarization. While in the autonomic nervous system we do have acetylcholine, so all preganglionic neurons will secrete acetylcholine. The postganglionic neurons will either secrete acetylcholine, parasympathetic in a couple of exceptions, norepinephrine will be secreted by the sympathetic postganglionic. So sympathetic, you want to remember adrenaline, which is the same as epinephrine or norepinephrine, right? So here, depending on what the organ is, right? So for example, on our heart muscle, the sympathetic will be stimulatory. So it's norepinephrine that's going to stimulate our heart rate, for example. While acetylcholine on the heart will be inhibitory, right? They're going to slow down the heart rate. So it depends on what the organ is and hence the receptors. So here's a nice pictorial diagram picture showing the somatic nervous system, one neuron. So here's our central nervous system, this is in our peripheral nervous system. Target organs, one neuron, highly myelinated, secretes acetylcholine. In the sympathetic and parasympathetic, just ignore this one for now, we'll talk about it in a second. So we have two neurons, 1, 2. The preganglionic neurons are lightly myelinated, while the postganglionic neurons are unmyelinated or non-myelinated. Both the preganglionic neurons will secrete acetylcholine, while the sympathetic postganglionic neurons, most of them, not all, will secrete norepinephrine. We'll talk about an exception, the sweat glands, that will secrete acetylcholine, but the parasympathetic will be acetylcholine, again secreted from that. So in terms of our autonomic nervous system, right, we have most of our organs have dual innervation. Not all, but most do. Sympathetic are fight or flight, while parasympathetic is called rest and digest. So if you look at these two cats, hopefully you might be able to guess which one is suffering or is being stimulated by the sympathetic. And hopefully, looking at the eyes, the fur, right, that'll be a giveaway sign. The nice beautiful cat's eye, that's the relaxed eye, right? So that's parasympathetic, this will be sympathetic. Okay, and we have antagonistic. What that means is if one increases it, the other one will decrease it, and it all depends on the organs. So we're going to look at some of them in the next slide. So parasympathetic on the eyes, we will have pupil constriction, right? So we don't need as much information to come, so it will constrict, while during sympathetic innervation pupils will dilate. They want to see as much as they can because fight or flight. On the skin, we can have, you might have experienced it, goosebumps, right? If you have some sort of if you're watching a horror movie, you were in shock, somebody surprised you, you would have felt your fur, I'm sorry, I'm still thinking about the cat there. That was a good example, right? The hair of our skin will stick up, just like that cat's one, right? We also will have vasoconstriction, vasodilatation, which we'll kind of talk about with the blood vessels themselves. In terms of the salivary glands, sympathetic nervous system will make our mouth dry. You may have experienced this maybe before an exam, right? While the parasympathetic will stimulate saliva production. Heart rate will be decreased, blood pressure decreased by the parasympathetic, it'll be increased by the sympathetic, right? Lungs, bronchoconstriction, the bronchioles are the little tubes, they will constrict during parasympathetic, while sympathetic they will cause dilatation of those bronchioles, which will enhance more air exchange, right? Then in the stomach, sympathetic will slow down the stomach motility as well as gastric juice production, whereas in the parasympathetic, good, nice, strong movements with production of our gastric juices. Pancreas, this is going to be a kind of a twofold. Let's look at it in terms of the exocrine function, that is to produce all those enzymes that will go to the duodenum. Duodenum is the next part from the stomach, so the first part of the small intestine. So it will increase pancreatic juice production, whereas the sympathetic will decrease pancreatic juice production. And one of the things that pancreas also produces is bicarbonate, which neutralizes the acid. So people who have stress ulcers, it's going to be in the duodenum because the pancreas is not producing that bicarbonate, which is not neutralizing the acid there. Liver and gallbladder, when they're listed together, their common function is bile. Liver produces bile, gallbladder stores it and secretes it, and bile emulsifies fat, right? That makes it water soluble and easily digestible. So you should be talking about this in ANP2. Adrenal glands, stimulated by our sympathetic nervous system, they will cause the adrenal medulla to release epinephrine and norepinephrine into our blood. Okay, in terms of the urinary bladder, sympathetic will not let it relax and have good contractions, so it makes it very tense. While parasympathetic will have nice movement of the urinary bladder. In genitalia, this is going to be the exception where it's not antagonistic, it's actually cooperative. So one initiates sexual intercourse, for example, or response to sexual intercourse, arousal, while the other one has to do with ejaculation. We'll talk about that in a few slides later. So next we're going to talk about the parasympathetic neurons. So we're going to be talking about the pre-ganglionic neurons. So there's two kind of locations that they can come from, either the cranial nerves or the sacral spine, right? So sacral, it comes from the lateral horn of our spinal cord. So that one, let's start with that one easier. The sacral spine, this is the image for that, will supply the organs in the pelvis, right? Everything else is going to be supplied by our cranial nerves. It's 4 cranial nerves, that's it. Cranial nerve 3, oculomotor, cranial nerve 7, facial, cranial nerve 9, glossopharyngeal, and then cranial nerve 10, our vagus. So cranial nerve 3 will go, and the ciliary ganglion will stimulate the iris, which will constrict due to this. Okay, while cranial nerve 7 has 2 ganglions because it's going to 2 different locations. Okay, so pterygopalatine ganglion will go to the nasal mucosa as well as the tear glands, which will cause tearing. So you may have also noticed when we cry, our nasal mucosa gets congested, we feel stuffy nose, right? And then second one is salivation as part of the cranial nerve 7, so it will send information via the submandibular ganglion. Cranial nerve 8, the autonomic nervous system action is also saliva production, so that's the otic ganglion. So otic, think of the ear. The parotid gland is very close to the ear. That's the biggest of our salivary glands. That's going to be innervated by cranial nerve 9. Then within our thorax and abdomen, it's going to be all by cranial nerve 10 here. Thankfully for our sake, I guess, we don't have to know the names of the ganglions. It's just going to be called terminal ganglia. It's going to be found at or very close to the organs it innervates. So our preganglionic neurons are going to be long axons, great because it's myelinated or lightly myelinated, while our postganglionic neurons are going to be short. So even though if they're unmyelinated, they will not slow down the impulse as much. So in these pictures, it looks like a fishbone. That's the postganglionic neurons, the head, the cell body, and then the axon plus its axon terminals, right? Excuse me. So next we're going to talk about the sympathetic neurons. Previously we talked about parasympathetic. Here also we have a similarity. We're going to have, well, in terms of the where the preganglionic neurons arise, it's all same for all of the sympathetic neurons. It's just going to arise from the lateral horns of our thoracic region and the top lumbar region of the spinal cord. While where the ganglion is going to be found is what's going to be different. So you can think of it kind of like a sandwich, if that helps. The diaphragm and above, as well as the pelvic organs, is one group, while the abdominal organs will be a different group. So we'll talk about that in the next slide. So here what's interesting is that the preganglionic neurons are short, okay, and while the postganglionic neurons are long. So it becomes a little bit of a disadvantage given that these postganglionic neurons are unmyelinated. This is why the adrenal gland comes into effect, which also gives us a sustained effect to a fight or flight response, right? So we're sitting here, you're listening to this video, you hear a loud noise, you're going to get startled, and it will, even though the neurons they actually went to all our organs within less than a second, but the response to that, your heart rate going up, our heart rate going up, is going to be a little bit more sustained because that adrenal gland responds as well. So we'll talk about that too. Okay, so it's going to be trunk ganglion. Okay, this sympathetic trunk is found just very close to our spinal cord. It's very close, just outside the vertebrae itself. Okay, while the other set that supplies the abdominal organs is going to be called prevertebral ganglia. So this is within our abdominal organs. We'll talk about it in a second. So sympathetic trunk ganglia, this is ganglia again. This is like a collection of cell bodies. That's why it's called a trunk, and you can see it's nice elongation, just not just a one little round yellow globule, but it's like a little train almost, right? So it supplies organs above the diaphragm and within the pelvic cavity, while the prevertebral ganglia will supply the abdominal organs, right? So there are, there are three ganglia I suggest that we know the names of, because these same three names you will come across as arteries that supply the abdominal organs, which arise from our abdominal aorta. Okay, so it's going to be the celiac ganglion, superior mesenteric ganglion, and then inferior mesenteric ganglion. So those will similar names. You'll have blood vessels. You have the celiac trunk, superior mesenteric artery, and inferior mesenteric artery, which will supply a lot of our abdominal organs. Most of our abdominal organs will be supplied by that directly. Okay, so let's go and look how this path goes. Okay, so here is our spinal cord. Here is the body of the vertebrae. Okay, you can see this is actually the rib showing a thoracic region. Okay, so motor neurons will arise from the lateral horn. They will leave through the ventral root. They will join up at the spinal cord. They will join the dorsal root, the sensory neurons, and then they keep going down the ventral ramus. So dorsal ramus goes that way, ventral ramus goes to the front. What they do is very interesting. They do a loop. Okay, so we have these two pathways which will go into the trunk. This is the trunk ganglion. Okay, so you can see this color coordination says white ramus and gray ramus. So hopefully you're thinking about which one might be white ramus, right? So it's the preganglionic neurons. Why? Because they have myelin. Remember, myelin is white in color, whereas the unmyelinated one is this gray ramus. What's interesting is they actually are going to do a loop. Rather than going in and out, they actually do a little loop, go into the trunk, and if they're coming out at the same level, they're going to come out as postganglionic neurons and then exit to the target organs, right? So, and I mentioned if they are leaving at the same one. So we mentioned, I mentioned that the trunk ganglion supplies organs above the thoracic, above the diaphragm and within the pelvis, right? So they come out of the spinal cord. Let me go back 1 second. So preganglionic neurons come out of the thoracic region, and they will enter the ganglion. All of them will actually pass through the trunk ganglion. Some of them will go up the trunk ganglion because they want to go above a thoracic region, right? They want to go into our eyes, for example, or close to our eye, right? So they will go up. Some will go down, right? We have, especially if we want to supply the sacral region or the pelvic region, right? So they're going to go down and then exit out. Okay, so and then if they want to supply the thoracic region, they just go through that same spot. There is another option. How to get to the prevertebral ganglia, we actually have to go through the trunk itself. So they enter the trunk, they go through, and then they will go to the prevertebral ganglia, right? Yeah, this should be named as ganglia rather than trunk. I apologize for that. The fourth option is that to supply our chromaffin cells. Chromaffin cells are the adrenal medulla cells. So that would be a third option. They're going to enter the trunk ganglia. They will not synapse there. They will pass through a vertebral ganglia. They will go to our adrenal gland and stimulate there. Adrenal gland itself behaves like the second neuron, like the postganglionic neuron. Okay. So next we're going to talk about the different neurotransmitters, which neurons release them, and then we'll talk about the receptors to them. So first of all, a recap of one thing, which was a somatic motor neuron that releases acetylcholine. So any neurons that release acetylcholine, any fibers, we call the axons as fibers. If they release that, they're called cholinergic fibers. Acetylcholine, it comes from that, right? All autonomic nervous system preganglionic neurons are acetylcholine releasing, so cholinergic. Also all of the parasympathetic postganglionic neurons. So the exception basically becomes most of our sympathetic postganglionic axons, right? Those are the only ones that are going to be releasing norepinephrine. I mentioned earlier, the exception will be at the sweat glands, it's going to release acetylcholine. And we can also consider our chromaffin cells. These are the ones from the adrenal medulla which release norepinephrine, also adrenergic. So another name for epinephrine is adrenaline. So noradrenaline, any fibers that release, axons that release that, is going to be called adrenergic fibers. Okay, so now we're going to talk about the receptors to them. So cholinergic receptors will be ones that will receive and be sensitized by acetylcholine, while adrenergic receptors will receive norepinephrine and respond to that. Let's look at the cholinergic receptors. We have nicotinic and muscarinic. While adrenergic, there is two major classes and then there's subtypes. The major classes are alpha and beta. The subtypes are alpha 1, alpha 2, beta 1, beta 2, and beta 3. So let's look at the nicotinic receptors. You can think of them as found on the target of the first neuron. So if it's only one neuron, like our somatic nervous system, right, on our skeletal muscles, it's going to be nicotinic. So motor end plate of the neuromuscular junction. But all of those ganglions, the postganglion neurons, the ganglions themselves will be the recipient of the preganglionic neuron, right? So they have to have the nicotinic receptors. Chromaffin cells will behave the same because they can receive the preganglionic neurons from our sympathetic nervous system. When these receptors receive the acetylcholine, when acetylcholine binds to these receptors, they will always be stimulatory. So that means the next cell in this sequence will be stimulated. They will depolarize and produce an action potential. Okay. While muscarinic is going to be found at the target of the second neuron. So, for example, in the target of our parasympathetic postganglionic neurons, right? So if we are thinking about the stomach, the gastric glands, for example, they will contain muscarinic receptors which will respond to the acetylcholine released by the postganglionic parasympathetic neurons. Okay, and then we also mentioned how I mentioned that the sweat glands also will receive postganglionic neurons from the sympathetic nervous system will receive acetylcholine, so they'll also contain muscarinic. So target of the second neuron will contain muscarinic, while the target of the first neuron will contain nicotinic. And here, depending on what the cell is, it could either be excitation. I gave the example of gastric glands. They're going to be excitatory there, right? The acetylcholine coming is excitatory. While if we looked at the heart muscle, say the sinoatrial node, that's the pacemaker of the heart, or if we have the parasympathetic, or rather when we have an impulse coming down, the parasympathetic postganglionic neuron, it is going to cause an inhibition of those cells. So depending on what the cell is, what the target organ is, it could have either excitation, whatever the parasympathetic wants to excite, or inhibitory, whatever usually the sympathetic excite, the parasympathetic is going to inhibit, right? Adrenergic is a little more complicated in terms of the arrangement, so this is just a little summary. Just learn it like this for now. You go into more details where some organs have more than one subtype, and then especially when you go over pharmacology, they're going to talk about all these differences. But here it's just a big picture principle. When we have alpha 1 and beta 1 receptors in an organ, we can consider it an excitatory, so that will cause depolarization. If the organ has alpha 2, beta 2, generally we will say it causes inhibition of those organs. And then beta 3, the best understood, is in animals that hibernate. So when we have the response to beta 3 innervation is everything slows down, whether it's the heart rate, whether it's the digestive glands, right? Everything slows down because you want the total metabolic rate to be very low, so they can just hibernate through winter and then they can come out because they don't need to have a very high heart rate or have high gastric glands activities, for example, right? So here are some ways in which we use this information, right? We develop medications that will somehow affect one, either they will stimulate or block them, okay? So here are some examples of that. Again, you'll go into more details. I just wanted to recap on two. So the sympathetic, so this one stimulates it. The one you want to think about is albuterol or Ventolin or salbutamol. These are ones that are used to treat asthma patients. So they will cause bronchodilation or bronchial dilatation rather. Okay, so stimulating sympathetic nervous system. While we can look at beta blockers, you may have heard of propranolol is a beta blocker, very well known. One of the oldest ones used to treat hypertension. Hypertension we'll talk about, or rather I'll mention it here, is an overstimulation of the sympathetic nervous system on the blood vessels. That's one cause of it. So stimulation will cause vasoconstriction. Vasoconstriction increases blood pressure. Blood pressure is basically the pressure exerted by the blood on the walls, right? So they exert it on the walls. So if we have a smaller diameter, you might have heard, say, a tap, you open it up, you let it run, it goes at a certain speed, you cover half the opening with your finger, it squirts out even faster, so the pressure's increased, right? So beta blockers will decrease blood pressure. They actually will cause vasodilatation. Here are some effects. Again, lots very important ones. I'm just going to highlight a few of them. Adrenal medulla, it's only stimulated by a sympathetic nervous system. It's going to release epinephrine and norepinephrine into the blood when they are stimulated by the sympathetic nervous system. Heart muscles, parasympathetic will decrease heart rate while sympathetic increases heart rate. While on the coronary blood vessels, these are little blood vessels on the heart. They supply the tissue of the heart. There's no effect on the parasympathetic. We always have a good flow. It's when we need to increase the flow, sympathetic response will be to dilate those blood vessels. In the lungs, parasympathetic will constrict the bronchioles or the little tubes, while sympathetic will dilate the bronchioles. Then a couple of others, digestive, increase in motility and amount of secretion by the parasympathetic, while the sympathetic will decrease the activity, whether it's muscle or even the juices as well. They'll constrict our sphincters, right, which is why we feel full. You may need to use the restroom when you're nervous. When we're nervous, we feel that we need to void, but the bladder is really not full, but it feels that way. In terms of the blood vessels, it's again the sympathetic which causes vasoconstriction. We'll talk about this in a second. It just basically decreases in the tone of it, which decreases, which causes dilatation rather than the parasympathetic itself. Okay, so sympathetic tone is one that, similar to our muscle tone, we have a slight contraction without movement in skeletal muscles. Here what we have is always in a slightly contracted state, right? Especially our blood vessels, they're always in a slightly contracted state. If they're totally relaxed, they cannot maintain a blood pressure. You might have heard of shock, not the electric shock, but just cardiogenic, could be hypovolemic shock in terms of persons. That shock is when blood supply is decreased throughout the body. That's because of vasodilatation. Okay, so during sympathetic responses, these fibers will fire more rapidly, hence vasoconstricting, while when we are relaxed, we don't need a high blood pressure, they will fire less rapidly, right? So if you want to block them, you block alpha, beta, and which will cause vasodilatation and hence can treat hypertension. Parasympathetic tone, again similar. It's always firing, dominates in the heart. It slows down the heart. Normally, without parasympathetic innervation, heart rate would be about 100 to 120. Parasympathetic brings it down to 60 to 72, right? Normal activity of our digestive tract and urinary tract, again, kept going by our parasympathetic organs. Please note, during a sympathetic response, if a sympathetic nervous system is innervated, the postganglionic neuron of the sympathetic is innervated, it overrides parasympathetic. So during stress, doesn't matter what the parasympathetic is doing, all the organs listen to the sympathetic, basically. Okay, so drugs that block the parasympathetic will have side effect of increased heart rate. They can also cause urinary retention and fecal retention because they will cause contraction of those sphincter muscles. I mentioned earlier about the cooperative effect of the two. This is seen in external genitalia during sexual intercourse. Parasympathetic is going to be part of the erection part, vasodilatation, and then sympathetic will be the ejaculation part of it, the climax part of it. Okay. In terms of our control, we consider the hypothalamus, the boss, the overall, the master control of our autonomic nervous system. Other things play a role, right? The limbic system, for example, that's our emotional. When we are angry, when we are excited by something, right? Our limbic nervous system will kick in. That causes our heart rate to increase, for example. Right. We also have our brainstem, the reticular formation. Hopefully you're thinking about it. It's in our midbrain, the red nucleus that tells us that we are awake, kind of thing. So once when we're sleeping, our heart rate slows down, right? When we are awake, the heart rate will increase to what we would consider normal, a little bit higher than while we're sleeping. Okay. We also have any reflexes, right? That will also affect possibly how the hypothalamus responds to it. So I hope you found this video useful. This is a short, quick synopsis of the autonomic nervous system. Hope you found it useful. I hope to catch you in another video. Have a great day. Have a great day, everyone.